Next, I want to turn to Lourdes Valdez, who's the Director of Workforce Development and Grants at RWJ Barnabas Health. It's important to note that RWJ Barnabas Health is our state's largest employer and has been an incredibly important partner for us here in the community colleges, working on a number of exciting initiatives. And we are very excited to have Lourdes and her team talk today and be part of this important Pathways and Skills Collaboratives efforts. So with that, I'd like to introduce Lourdes.
Thank you, Aaron, and thank you for your leadership, and thank you for your support and this great vision that you have afforded us to our as employers. And thank you for your friendship and partnership. So one of the things that that RWJ Barnabas did in 2018 is establish a division within human resources for workforce development. There was a beginning of understanding of how workforce development ties to recruitment and creating talent pipelines. No longer can we consider the traditional methods of recruitment as efficient or sufficient to be able to provide and fulfill the talent needs that the organization needed. So upon the initiation of this division, we were able to create various partnerships. We understood very clearly that our partnerships with our community colleges, partnerships with community organizations was key to the success of our division, because they understood exactly what workforce looked like. Believe it or not, our biggest challenge was internally. Sharing with our hiring managers, sharing with our leadership what workforce development was about. Fortunately, through our partnerships with the community colleges, we have been able to prove the worth of workforce development within an organization, not only as a public government entity. So additionally to that is, for us, our biggest wake-up call has been our pandemic, COVID-19, realizing that the skills of our employees needed to rise up to that occasion. So the ability to be able to provide our employees to hone their skills, to improve their skills, but not only professionally, but also personally, from time management to stress management, and to be able to support them throughout those challenges has been key to the success of our services to our community. I wanted to also add that preparing the future workforce within healthcare is extremely important, because as Aaron has very well said, we do not know what it's going to look like. We do not know what is going to, even within healthcare, as best as we guess, as much as research as we're putting behind this, we still have to wait what this is going to look like at the end and how we're going to come out of it at the end. But we have to make sure that our employees are prepared to come out at the end, that they're able to give the service to the community that we are committed to do. So one of the many efforts that we have started is working with apprenticeships. That has been where we have been able to put into training in a 2-year college. So once I want to go back a couple of steps. Many times in healthcare, specifically with apprenticeships, training happens, as you mentioned before, Matthew, you have a 3-year program. But many times in apprenticeships, the vision is, on-the-job training, quick training, on-the-job training. But in healthcare, you cannot provide services to a patient until you're licensed, correct? Until you're certified to do those services. So for us, it's a little bit different. Apprenticeships look a little bit different. First, we have to provide the training, then we're able to put you on the job to give you that, to give you that experience. We have been, we were lucky enough to receive $800,000 from the state of New Jersey for apprenticeships, where we currently have 60 of our employees, more than half of them as medical, in a program, a 2-year program at Mercer Community College for medical lab technicians. Wasn't that a great, I said, what a lucky guess we had that we were able to put that into place when laboratories became such critical during the pandemic. Also, we have about 17 paramedics also receiving training. Another great guess. And along with that, we also have our advanced certified nursing assistant program. They're all key to the success of our services to our community, to address the pandemic issues that may be coming up. So we're very lucky to have those apprentices in place. Additionally, a very exciting thing is that we have been partnering with the community colleges through their CCOG program, where we're able to provide our frontline employees and those that do not have a degree, the opportunity to receive funding to continue their education. I remember when we first approached, Aaron and I first spoke about this, and Catherine, with Zakir, and I remember when we said we only have a month to recruit employees to participate in the COG before the fall starts. Aaron goes to me, goes, well, Lourdes, do you think we could get 100 employees enrolled? And I said, I think we can do a little better than that. We had over 400 employees respond within 1 month to be able to enroll in the community colleges. That has, and to create a process together with Zakir, with Catherine, and to create a process where our employees are being supported and encouraged to continue their education has been priceless. Talking about a great retention tool for employers. So for us, we continue to work towards this partnership. We continue to support anything the New Jersey Council of County Colleges invites us to participate in, and definitely would love to share this with other employers. I think I would love to talk to the NJBIA and speak about this to them also, because I think we have a great model in place that is working and that we can set as an example. So thank you all for listening, and I look forward to our work together.
Thank you so much, Lourdes. Thank you for the partnership. I think we are proving that if we can come together and find common interest, that we can really move all of our work forward and really make a better New Jersey, because those employees that you are helping are going to move up the career ladder, get more earnings, and be better members of their families. It's all a very, very good thing. So thank you, and we look forward to Barnabas's involvement in the health services pathway and skills collaborative in particular. So thank you very much.